She apologized for it, but does that really cut it? Not for Tennessee Republican Senator Lamar Alexander. He's the highest-ranking senator calling for Secretary Sebelius to leave. Why, Senator?
Well, because of the disaster with the rollout of the website. I mean, she's going to Memphis tomorrow, and while she's there, I hope she explains to thousands of Tennesseans who are receiving cancellation letters why they're going to be out of insurance on January 1 because the website won't work.
You know, I don't know if you've heard, sir, but they're not getting canceled, they're getting transitioned. That's the new buzzword. What do you think of that?
Well, that may be, that's not exactly what the letter says, because we're beginning to get letters in our office, thousands of Tennesseans, about 1.5 million across the country that we've been able to identify. And what they're finding out to their shock, that after January 1, the policy that they've had and they were promised they could keep, they can't keep because it's illegal under Obamacare.
You know, Senator, I know when this was being debated and I was on Capitol Hill, I should have gotten a condo in Washington. I'd spent so much time there. But when you and I were chatting about this, one of the things I distinctly recall is this notion of you can get something for nothing, a lot of things for nothing. And that it would strike me as common sense that if you're going to have to include 30 million more Americans who don't have health care to get health care, those are the pre-existing conditions, your kids on the policy until they're 85 or whatever it is. I'm joking. But my point is that that's going to cost more. And for the administration and those who are advocating this to argue otherwise, it was at best disingenuous, if not devious, wasn't it?
Well, of course it's going to cost more. I mean, the basic problem with the new health care law is that we expanded a health care delivery system that already cost too much. So we knew it was going to cost too much. We should have gone the other direction, which was the way Republicans were arguing, which was introduce competition and choices and try to reduce the cost of health care so more people can afford to buy it. That was the fundamental difference of opinion 3 years ago.
Well, that was then. Nothing happened since. But you're quite right. But now I guess back to Ms. Sebelius. She has more or less said, and we have a clip I want to show you in a second, where it's not up to you to tell her to go. It's at the behest of the president. So I essentially think in this bite, she told you where to get off. This is Kathleen Sebelius.
Well, the majority of people calling for me to resign, I would say, are people who I don't work for and who do not want this program to work in the first place.
What did you think of that?
Well, she works for the American people, as does the president. And even in the public sector, there's the principle of accountability. I mean, when I was governor of Tennessee, I made sure that if I had a road project that needed to get done, that I signed it to somebody who was in charge and that it was on time and on budget, or that person was gone. And when Admiral Rickover was head of the Navy in the 1950s, he started the submarine program. He told the captains, you're in charge of the reactor as well as the ship. If there's a problem with the reactor, your career's over. So accountability is an important part of public life, and if the secretary were in the private sector, she'd be gone.
Senator, thank you very much.
Thank you, Neil.